Weakness, numbness, and pain in the hands and feet. It can be so difficult to live with, but our next guest says there is a treatment that can help. This is Dr. Patrick Sartz of Neuropathy Treatment Center of Arizona. Good to see you. Those symptoms I was just talking about, they are a condition called peripheral neuropathy. What is that exactly?
Peripheral neuropathy is actually a secondary disease process that affects the nerve endings at the skin level. Something has caused the cells at the ends of the nerves to actually die off and recede deeper into the tissues, which can give the symptoms of numbness, tingling, pain, burning, coldness. It can also start to affect their balance because the nerves are no longer going down to the sole of the foot, so that they might feel like they're walking on a sponge or a piece of cardboard. And it can get so bad that they actually lose awareness of where their feet are at, which can make it even difficult to drive because they can't tell whether the foot is on the brake or the gas pedal.
Oh, that sounds terrible. So how long have you been treating neuropathy here in the Valley?
I've been treating it since 2008. My interest in it because of my mother having it for 32 years and spending the last 16 years in a wheelchair. Never found anything to help her. She passed away in 99, but in 2006, we came upon some things that showed promise. I started treating patients in 2008. Learned a lot because I made a lot of mistakes over the years, but over the last 12, 13 years, we've developed a protocol now that can give 60 to 70% relief of the symptoms of neuropathy, 80% improvement in the balance for 95 to almost 100% of the patients that we actually accept for care.
So why are neuropathy patients often told nothing can be done?
Two reasons primarily. Our healthcare system overall is based off of two premises. One is medications or surgery. There is no medication that can actually stop neuropathy from getting worse. At best, it'll mask the symptoms, but as time goes along, you may need to increase the dosage or switch to a stronger medication. Surgery, there's no surgery for 98% of the people that actually have neuropathy. If the cause of their neuropathy is due to the fact of the loss of blood flow or possibly pressure on a nerve, there are surgical interventions that can help that. But those are less than 2% of the actual people that suffer with neuropathy that can find benefit from that. The second reason is there's a lot of treatments out there that are FDA cleared that actually can reverse neuropathy, just like ours. The problem is they're done in office, which is the mistake that I made years ago. We would treat patients to have them come into the office for a series of treatments. They'd get better, they'd get released from care. They might go see their doctor and go, "Doc, I'm doing great. I don't need the medications anymore." But 6 months, a year later, we didn't deal with that cause. The neuropathy starts to come back. And so they go back in and go, "Doc, I need those medications again." So their doctor's looking at it, well, there's no drug that'll help. And these other alternative treatments didn't work. So there is no cure for neuropathy.
All right, well, that's what I was going to ask you. Neuropathy is said to be incurable. Do your results last?
Our results do last because there is no cure for neuropathy, but there is treatment. I look at it as being like a wilted plant. You can find a wilted plant, you add water, give it some fertilizer, maybe new soil, and you can bring it back to life. But what happens if you stop watering it again? It'll wilt. The same thing happens with neuropathy. You need to do the treatments, you can get the nerve endings to come back, and you can be pretty much pain-free from the neuropathy. But if you stop the treatments, after a while, it's going to start coming back. This is the reason that all of our treatment protocols are actually home-based so that they can treat themselves at home, get the neuropathy under control, and then maintain that for the rest of their life. Yes, there's still some office visits involved, but not a lot of them. But I do make myself available to my patients from 7 o'clock in the morning till 9 o'clock at night, 7 days a week, so that as they're treating themselves at home, they can get their questions answered. And so that's the reason that our treatment protocols last.
How do you sleep and when do you sleep? Thank you, Dr. Sartz. We want to give people a special offer now so that they can get in contact with you. The first 20 callers, you will get a free neuropathy consultation. Neuropathy Treatment Center of Arizona. They are located at 2150 South Country Club Drive, Suite 14 in Mesa. Call 480-556-1358 or go to freeneuropathyconsultation.com. And just to note, masks are required, temperatures are checked, and they do limit the number of people in the office.